Hello, I'm Dr. Mohammad Ali Khoshnevisan. I'm a hand and wrist specialist and surgeon with Town Center Orthopaedics. I've been here for 4 years, going on to five. I practice out of Fairfax, Centerville, Reston, and our Ashburn offices. Any kind of repetitive use of our hands for any activity can cause tendonitis pain. Those are what our muscles can use to connect to the bones that go into our fingers. And then, so certainly with cell phones, we are all using it as our main way of communicating, text messaging being very easy and convenient, and then also browsing the internet, spending our time on our phones and devices. So, tendonitis is the main issue we have with any kind of repetitive use or overuse of our thumb and fingers when it comes to cell phone use. Tendonitis is the most common when it comes to pain in the hand and wrist with significant repetitive use for cell phones. In terms of when to see the doctor is when rest and typical splints just do not seem to be doing the trick. It can also be aggravation of underlying conditions such as arthritis, and those can lead to worsening symptoms and inflammation and then lead to worsening tendonitis. So you should see a provider when rest and splinting don't seem to be doing the trick, or if those are not options for you and need to continue using your hand at a certain level and need help getting through the pain. Our rest and ice continue to be our first line of therapy to help with hand and wrist tendonitis. There are other options. This is also not new or cutting edge, which is steroid injections. They can be some discomfort in getting them, but they can tremendously help reduce inflammation and the pain that come with them. There are some experimental treatments that include, and you may hear, stem cells, PRP, using your own body's recovery tools in the blood to help that calm down. However, we still do not have strong evidence that it's going to be helpful from a population basis. So it's very much out of pocket and experimental. And some say it works great, and some say made no difference at all. So that's probably our newest way that these conditions are being treated. However, we still don't have significant scientific evidence to support its use. To modify our phone habits, it's truly coming away from the screen and using our hands and thumbs. So using as much voice to text options is very helpful. It's also been becoming very popular to send voice notes. Those can be a great way. Not everybody likes listening to voice notes because they can be very long, but those are ways that you can kind of take away some of the tapping and repetitive movements for our phone use. So I think car technology is getting better and that we have Apple and Android features in the cars where you can talk to your phone to reply to messages. I think these are going to be ways that we can reduce our repetitive use. And then also the bigger phones are going to be heavier and weigh more as we hold them in our hands for a longer period of time. So sticking to the sort of this smaller phone that is still functional for you can also be helpful in reducing how much stress goes against the hands, joints, and tendons.